Lynda, I'm so happy to have you here with me and learn about what you've been working on with Curatio. I understand you've built this social network for folks who are going through illness and disease, a social network for health that seems to help them not have to go through what they're going through alone. So tell me about Curatio and what you're doing.
Yeah, it's great to be back and nice to see you. So yes, Curatio is a social health prescription, which means for anyone who's been newly diagnosed or gone through a health event, it's an entire support model that is delivered at scale to patients now in more than 100 countries and 20 languages.
Wow.
And so a lot of us can relate to this. You know, you have that heart attack, that cancer diagnosis, you're living with a rare disease, and in a matter of seconds, your life changes. So where do you go? What do you do? And how do you live every day? So yeah, we're using AI, machine learning. It's a technology platform. It plugs into any of our customers' existing systems, and what it does is matches patients to other patients that are going through a similar journey, but not only the same journey, but also in terms of who they are, you know, where they are in that journey. We surround them with a whole ton of evidence-based health literacy programs, coaching, day-to-day check-ins, live events, telehealth, and then very importantly is trackers. So everything from medication reminders through to qualitative and quantitative trackers, which then in turn give our customers really amazing contextual insights into their own patient populations.
I was going to ask you how this is an upgrade to a patient group on, say, Facebook, but you started to touch on that already with the reminders and with the AI. So what are some more of those features that make this very different than what we typically think of as a social network for patients?
Yeah, great question. So, you know, social networking has been tremendous and has helped us connect around the world, but it has some real limitations for healthcare. And so when we started out now over 8 years ago, was really with three principles, or the 3 Ps we call it. First of all, it had to be private. And so we are privacy compliant worldwide. We're also regulatory compliant for our life sciences and pharmaceutical manufacturers. So privacy was at the core. We started working on it from day one. Mm-hmm. The second is plug-in. So it wasn't going to be another walled garden. This is a software platform. It's a SaaS platform. So any life sciences organization can use it and plug it into their existing offerings. It's not meant to be yet another portal that you go to. It's meant to be integrated.
Describe that integration to me. Give me an example organization and how they might use Curatio.
Yeah, for sure. So we're doing a lot of work in terms of our private label, which was the 3rd P.
Okay.
So the private label meant it needs to look and feel like that patient's experience, whether that's your provider brand, your therapy brand. It needs to be a part of that experience. And so, you know, we've really focused in on where does the patient onboard? Is it through a patient support program? Great, we'll integrate there. Is it more of an open model through a website? Super, we'll integrate there. But we go to where is the most natural point for that patient to be onboarding, and we integrate with our customer's point there. So it's seamless, it's easy, as it should be.
Yeah. Talk to me about a patient whose life has really been changed because they got connected into a care community on Curatio.
You know, this is the most meaningful part of our day. So we have community managers around the world, and they share with us in you know, de-identified, of course, patient feedback every day. And what we hear, you know, and it's both inspiring and heartbreaking, because what we hear every day is like, oh my goodness, I felt so alone until I met, you know, this group, or I didn't know that other people were going through this, or I've really been struggling on, you know, day to day and remembering my medication, all the things I have to do, and now I've got support. I've got someone in my court. So really life-changing, and not only, I mean, that's all sort of feel-good stuff, but, you know, our evidence is showing that, you know, 92% of patients are remaining on therapy. Our net promoter score is off the charts. You know, we're increasing statistically significant improvements in self-management and efficacy and adherence and retention and persistence. So
you said you're in how many countries?
Over 100, about 104.
So what kind of tangible clinical benefits are there to just connecting people with rare diseases? Because with such a big catchment area, you're going to find connection points between people that you wouldn't have found otherwise.
So there's a couple of really big things in terms of healthcare transformation. So one is the exchange of lived experiences, and that's important. But secondly is the exchange of protocols. So what's being done in one country versus another. So that patient empowerment and patient knowledge is a second. A third, which is super interesting, especially in rare diseases, are things like predictive analytics. For many of these rare diseases, there's not really a big data set, or sometimes not a data set.
Yeah.
So when you start connecting people, you start to then have a data set that's meaningful, and a data set that can then go into sort of the R&D cycle and hopefully eventually curing these diseases.
Yeah, so is there a strong research component to this?
Yes, absolutely.
Got it. Using your AI to kind of bring that de-identified data to the surface.
You got it.
So what are you most excited about for what's next for Curatio?
Oh my. Well, we have a mission of no patient alone. So we want this to be in the hands of every patient on the planet. And so the uptake that we're seeing, and it's just it's beautiful because the patient does better, the provider's life is easier. Our life sciences companies are being of great value and are able to understand their patient populations better. It's costing the system less. So it's good for people, it's good for the planet, and it's a viable business. So I just want it to be in the hands of every patient on the planet.
Yeah. What you've gotten recognized as distinctions as a CEO and an executive. I like to ask certain guests, what's a piece of wisdom that you would give to a healthcare founder who's earlier in their journey than you are?
Ooh, my, that would take a few hours. It is a journey. Certainly having your own network. So having, your own tribe, your own round table of other CEOs that are going through the same thing has been hugely valuable. That's been a real gift of StartUpHealth and Springboard, and I've got 3 round tables that I'm on just to show the value. So, when you're learning from your other peers that have gone through a similar thing, it really helps you not only grow your business, but it helps you as a leader, and it helps you see your own blind spots and become the best person and best leader that you can be.
Awesome. Lynda, thank you for taking the time with me today. Wish you the best at this conference and this year as you keep growing the company.
Oh, thank you so much, and
All right,
to you
be
as
well.
Yeah.